do a 3 treatment protocol. We're going to do the IPL, which is the OptiLight. That's FDA approved for dry eye, but we are going to be treating the red cheeks and around the eyes to stimulate the cell turnover and to improve the tear production and reduce the inflammation, as well as address the facial rosacea.
Thank you. Okay.
And then Raquel will do the triLift with radio frequency with the dynamic muscle stimulation to improve the lid function and to liquefy the glands that are sitting there and just not really lubricating the eye. And then the third part, I'm actually going to be checking the lids and the glands and clearing them out, which is my favorite.
We've got a lot to do today.
So let's go. First shot, just so you know what it feels like.
Okay, it's a test shot.
Yep, 1, 2, 3.
Okay.
How does it feel?
It's fine.
So there's really, you shouldn't have, you can have some sensation, but no pain, because the setting to stimulate the tear film is just really, really light. And it affects the mitochondria, which is the powerhouse, as we all know, and all the longevity stuff only talks about the mitochondria. So that's what we're doing here. We're stimulating mitochondria to produce tears. And I go right around the eye orbital bone where the oil glands live. Now, the side benefit of this treatment is, of course, lifting and stimulating all the pigments. So patients really enjoy that even skin tone after the treatment. Glad you say that. It is also, this technology has a cooling tip. So it cools the skin as it hits as the light is being delivered. You might feel it where the inflammation is in your cheeks. You might feel it there. You feel it, right?
Yeah.
But most patients really enjoy the evening out the skin tone, the complexion benefits. And of course, we do need to address the rosacea, because there's actually a term that's called ocular rosacea. So all these broken blood vessels do grow into your lid margin. Perhaps you feel the pain, but it's more like a zap, like a lightning bolt.
Right.
One more and we're done on this cheek. Okay.
It doesn't hurt. It's just like a little,
like a zap.
That little zap. I mean, like, you can't. It would be hard not to like flinch. It would be hard not to flinch.
Look, when I get treated, I flinch, but when I treat myself, I'm a much better patient.
Thank you.
It's just the cheeks. Once we get rid of these broken blood vessels, you will have flawless skin.
Wow. Why'd I wait so long?
Well, but IPL is still the best for rosacea. Can you tell that, like, how much more uniform the cheeks are? Do you see it? You don't really see the blood vessel anymore. It's just like a beautiful rosy cheeks, which is what we want. Now, today, you may have something, if you look in the mirror, you may look like you were bitten by mosquitoes, which is a good response. You want that. You can take some Benadryl, do some cool compresses. You feel like it's hot, but you should be fine.
Okay, Stacy, so you just finished with the OptiLight. We targeted your full face along with your eyes as well. Now we're going to move over to the triLift. And what the triLift is going to do is use dynamic muscle stimulation in order to stimulate the muscle around the eyes, waking it up and strengthening it.
Okay.
This is going to help increase your blinking rate. It also uses radio frequency in order to melt down the oils within the glands, but we're also waking up the collagen within the skin to help tighten and lift the skin around the eyes. We'll be using it for full face next time, but for today, we're just going to target with your eyes, okay?
Okay.
Perfect.
Got to start somewhere.
Right? I don't know. And this is just going to allow the instrument to smooth, glow, and glide as we're moving on throughout the treatment. What you'll feel is a involuntary twitch as we're going, and that is just DMST working along the muscle. And when starting, I'm going to move around. I have you at the baseline setting just so we can get comfortable with what we're working with. How does that feel?
I'm not twitching yet.
Good. We're going to work our way up. Here we go, okay? How does this feel?
Feels sort of nice. Warm. It's warm.
So that's the radio frequency part.
And you do feel like a little bit of an electric like current.
Yes.
What we're going to do is shut off the radio frequency, and we're just going to do the dynamic muscle stimulation.
And that's when the twitching starts?
Yes, and we'll
All right.
use it on 4 focal points for about 10 seconds each.
What are the focal points?
So we're going to target right near the brow, near the crease of your eye, and then 2 points along the cheek.
It's funny.